Today's date is January 9th, 2014, the new year, and we're here with a doctor, medical doctor, Karima Harani from Southern California, who came here to train today. And I'm making this video because I wanted the viewer to hear from a physician what happened with one particular patient today and some dental work. Go ahead.
Hi, I'm Dr. Karima Harani, and Dr. Rowan wants me to talk about a patient who came in today. She had chronic bilateral knee pain, and when she walked, her knees clicked, and she also had neck pain and stiffness. And so what Dr. Rowan did is he injected her knees with ozone, and she had immediate relief. And then he...
What did I do before I injected her ozone? I checked her tooth.
Yes, you checked her teeth, and you, through muscle testing, Dr. Rowan discovered some areas of weakness in her teeth. And then he did an injection with some lidocaine and in one of the through the gums in one of the teeth. And then she had immediate relief of her range of motion in her neck, and she was able to move her neck to the left side where she couldn't. And there was probably about a 10 to 15% improvement in her range of motion there. She also noticed that her left knee, I believe it was her left knee that was better, and then Dr. Rowan proceeded to give her the injection with the ozone in her knees, and then she had complete improvement. And he also did muscle testing along the facets in her neck. And when he palpated against one of her facets, one of her spinal bones, she had weakness with the muscle testing, and that's the area that Dr. Rowan injected, and she had immediate improvement, where she had only had about 10 to 15% of improvement with range of motion. She now had full range of motion, and it was really amazing to see. And she had relief in her pain as well.
And that had to surprise you, I think?
Most definitely. Most definitely.
Okay. And as I recall, after we did her tooth, that was before I shot her knees with ozone, she had very significant relief of pain in her knees just from the tooth. Is that correct?
She had already noticed significant improvement after the injection to her tooth.
Yeah.
Correct.
For the viewer, that tooth happened to be the lower right canine tooth.
Right here.
Yes. The lower right canine or eye tooth. That happens to be in the acupuncture meridian of the liver gallbladder. In Chinese medicine, the liver gallbladder energy system controls tendons. And she was clicking, tendon-type clicking out of her knees. So that's potentially a cause. I can't come right out and say it, but now she has to go to a dentist to have that area x-rayed. Now remember, she had other problems, other root canals, right? And missing teeth.
Yes.
This is the only one that I found to be positive. And when I treated it with a tiny amount of procaine in a treatment you had never seen before, she had dramatic pain relief in her knee.
Dramatic.
And partial relief in her neck.
Yes.
And then when we treated her neck with the ozone, complete relief.
Complete relief.
Thank you.
Thank you.
May I post this on YouTube?
Absolutely.
Thanks.